Hello again. We are going to discuss about the prognostic factors for breast cancer. Prognostic factors means the factors that gives you prognosis, and the prognosis is the forecast for the outcome of the disease, and that are always considered by your doctor. And since you have the biopsy and it shows that it has a breast cancer, you really want to know how much chances of your survival are there, and whether am I going to live or not, whether the cancer will recur or not. And these prognostic factors help you to understand the course of your disease and the possible outcome. The number one is the lymph node, which is very important prognostic factor. The lymph node, as you know, are present throughout your body, and they circulate the fluid called lymphatic fluids. And if it stops somewhere, they take with them the cancer cells. And if you have axillary node or the nodes in the armpit, it means that the cancer has gone from the breast to the axilla. And that shows that it is the prognosis will be poor. The other factor is the size of the tumor. You may have sub-centimeter, you may have 1 centimeter, 2, 3, or maybe above or greater than 7 centimeter. This size helps your oncologist to place in the classification system and help him to determine what treatment they can offer you. The third important are the receptors, which are the proteins present on your cells, and they are ER, estrogen receptor, PR, progesterone receptor, and HER2 receptor. These are very important, and they are ER positive or PR positive or HER2 positive, or all of them can be negative. Their presence also helps in deciding the treatment medications by your oncologist. If somebody has ER positive, PR positive, and HER2 negative, they will get one set of chemotherapy. If somebody has only HER2 positive and ER and PR negative, they will get another type of chemotherapy. And if there are triple negative, meaning ER negative, PR negative, and HER2 negative, they will have a different kind of treatment. And that can be a difficult one. So that depends on your oncologist what to choose. Then comes the histopathology, and in histology there is a tumor grade which is well differentiated and poorly differentiated, or the nuclear, which is low grade nucleus of the cancer cell, or the high grade nuclear cells. What is that means that the pathologist sees the cells and their nuclei under the microscope, And because of his experience, he tells that these are poorly differentiated or intermediate or well differentiated. Well differentiated have good prognosis, and poorly differentiated have poor prognosis. The same is true about the high grade nucleus of the cancer cells. Then there is also Ki-67 test, which predicts that if the large percentage of the cells are proliferating, they are proliferating fast, then it is possible that the patient will have dissemination of the cancer as well as the recurrence of the cancer. And all those things, they determine that what treatment you should take. I hope if you grasp these fundamental basics of your cancer, I'm sure you will have a pretty good idea what course of your disease you are going to follow. Thank you so much for listening, and I'll see you later.